So here are three pieces of advice that my parents tell me they've received at a newborn nursery that I don't necessarily agree with most of the time. Hi, this is Dr. Bidi, pediatrician at Partners in Pediatrics and Family Health and CEO of Newborn Prep Academy. And we're going to talk about three advice that parents receive often at newborn nurseries that I don't think are necessarily accurate, may not be harmful, but often just cause undue anxiety or worry. And so we'll talk about them today. So first off is number one is that parents often told not to use any body cream or lotion on their babies after they've been discharged from the nursery. So typically, babies are not no lotion or cream is applied on babies while they're at the hospital, and mostly that's really because hospitals don't want to deal with unnecessary litigation from parents who are concerned about a rash that developed, and they now blame it on the cream that the hospital used. Newborns have all kinds of rashes, and I've made a number of videos on some of those that are normal or quite often seen in newborns that are not dangerous. And so, understandably, it's one less hassle for a hospital to have to deal with unnecessary complaints about a rash and attributing that to the cream that was used on their baby. However, it's completely okay for you to apply lotion that you've bought, baby lotion appropriate for a baby that you've bought when you get home. Oftentimes, parents will come for that first visit 3 or 5 or 6 or even a week later. Well, I was going to say 2, 3, 4 days later, or even a week or so later after discharge, and they still haven't applied any lotion on the baby, and the baby's skin is very dry, and they're concerned about the baby's dry skin. So I often say, hey, whatever lotion you've already purchased, go ahead and use it. If your baby develops a rash, then you'll know they're probably sensitive to that particular lotion, and you'll get something else. There are very few cases, I can't even think of any right now, where applying lotion, on your baby will be such a dangerous thing. Certainly, everything I'm going to talk about on this video is just medical information. It's not to be taken as advice. You want to check with your provider if there's some particular condition that your baby has and you're not sure about applying lotion. Certainly reach out to your medical provider. But yes, for the most part, it's really okay to apply baby lotion to your baby when they get back from the hospital, okay? So that's number one. Number two is that parents are often told to wake the babies up every 1 or 2 hours, sometimes every 2 to 3 hours to feed their baby. Now, this is a really good idea when your baby is still in the first several days and trying to put on weight. Most babies are going to feed every 2 to 3 hours, and if they're breastfed, sometimes every 1 or 2 hours. But it's okay for the vast majority of babies to allow them sleep up to 4 hours if they happen to have that one period or so that they have slept a little longer. But at the 4-hour mark, to certainly wake them up and try and feed them if they have not woken up. And all this is only until they get back to their birth weight. Once they've gotten back to their birth weight, for most babies, it's okay to allow them sleep as long as they want to. I usually say set an alarm for 6 hours, and if they haven't woken up by then, wake them up and feed them. But again, this is for a baby who we've established is putting on weight, they've passed their birth weight, they're growing well, no medical issues, right? But until your baby is back to their birth weight, you do want to feed them frequently to make sure they're getting enough calories. But it's okay for the vast majority of babies, in my experience, for them to sleep up to 4 hours once, or twice in a 24-hour period. And if they're not awake, then I wake them up and try and feed them. So that's number two, really not allowing your babies sometimes to rest a little longer and when they are born. Now, the other piece of advice that goes sort of along with that is that parents are often told, well, feed your baby only, 30 mLs or when they're born, because we don't want them to speed up. And so 30 mLs is like 1 ounce. And the truth is, it's very variable, the quantity of formula. If you're feeding formula or express breast milk, if you're using a bottle, it's very variable how much your infant, your newborn baby is going to feed. Some babies will feed only 1 ounce, which is about 30 mLs, and some will feed 2 ounces, which is about 60 mLs. I think the vast majority of babies will do about 60 mLs or 2 ounces, a little above that or a little below that. And so really what you want to do is try and get a sense of when your baby is full and is not as interested in the food you're offering anymore. Remember, your newborn baby has what is called a suck reflex. So if you put anything in that mouth, they're going to suck, because that's just a natural reflex that they have. And so just because your baby is sucking on a nipple doesn't mean that they're necessarily hungry. And so when you start to feed your baby their formula or express breast milk using a bottle now, for those who are bottle fed, there will come a point where they're not as interested anymore. They're not sucking vigorously anymore, and milk is beginning to sort of pour out their mouth. You want to stop at that point. Even if you have this much bit left in the bottle, try not to finish that last bit, because you don't want to waste the milk, because that's how you get to overfeed your baby. It's also different when your baby is breastfed, because oftentimes, because there's so much effort that goes into breastfeeding, and the baby has to actively engage, most times it's difficult to overfeed with breastfeeding, because the baby is just not going to suck hard enough to express milk from the mom's breast when they are full. Now they may do some very weak suck reflex that is more of pacifying themselves, but they don't get as much milk as they would if they were feeding off a feeding bottle with a nipple, where that flow is a little bit easier to get out. Okay. So there you have it. 3 things that oftentimes parents are told at newborn nurseries that I don't quite necessarily agree with most of the time. One is, again, you can use body lotion when you get back from the hospital. Number 2 is to allow your baby sleep up to 4 hours every now and then when they're in those initial few days, but certainly wake them up if they're not awake at the 4-hour mark to feed them. Remembering again that for the vast majority of the day, you're going to be feeding them every 2 to 3 hours, maybe even sooner than that. And the third is, really limiting how much your baby sucks out of a bottle in those first few days, because it is quite variable with each baby, and you want to sort of get a sense of what your baby needs. Of course, with all of this, you want to make sure that you're following up with your pediatrician, the primary care provider, that they're keeping close eye on your baby, making sure they're growing appropriately. That's absolutely important. And so, again, this is just medical information, but I hope it's helpful to you. If you're watching this on YouTube, like the channel, hit that notification bell so you get notified whenever we have a new video. And if you please share this with a friend who has a newborn or is expecting one, so that you can provide hopefully some information that they will find helpful as well. All right, till next time, it's Dr. Bidi here.